Hello, good morning everyone. Today we are going to see some more of the dermatological conditions which are frequently asked in USMLE. So here is the Lyme's disease. So if you see in Lyme's disease, we have the classic target rash. So there will be a rash and surrounding area there will be nothing, the skin will be clear, and following it there will be a bigger rash surrounded. So that is what is known as the target rash. This target rash is known as chronicum, Erythema chronicum migrans. This is the rash which is most commonly seen in Lyme's disease. How do we get Lyme's disease? Lyme's disease is acquired by the Ixodes tick, and the tick transmits the Borrelia burgdorferi, which is responsible for causing Lyme's disease. So mostly the ticks is found in Massachusetts, northeastern US, including Massachusetts. So the question will give you a hint like a guy from Massachusetts who had went hiking or who had a pet dog or anything in relation to ticks, they might give you in the question. So how will you treat the disease? Children, the disease is generally treated with doxycycline, but children who are less than 8 years and pregnant female should not be treated with doxycycline. They should amoxicillin should be given. One more thing that we need to remember is that Lyme's disease can present with the Bell's palsy. So when a patient presents with the Bell's palsy, we should have the Lyme's disease in the mind. So they may or may not give you a target rash in someone presenting with the Bell's palsy. So your suspicion should be high, and you should know for sure that Lyme's disease can cause Bell's palsy. What about the antibiotic? As I told you, amoxicillin is preferred in children who are less than 8 years due to risk of dental discoloration when a doxycycline is given. So therefore amoxicillin is preferred. And similarly in pregnant female also amoxicillin is safe. But other than younger children and other than pregnant female, for adults doxycycline is the standard treatment. But in severe and disseminated cases where it presents with the neuro symptoms and all, then ceftriaxone should be given if there is a cardiac or neurological involvement. What is doxy? What is Amox? Doxycycline is a tetracycline that will inhibit the bacterial protein synthesis. Amoxicillin is an antibiotic that disrupts the bacterial cell wall synthesis. So this is the difference in mechanism that you should know. But ceftriaxone, if you see, it is excellent for treating Lyme's meningitis and other neurological complications. It is also preferred for Lyme's carditis. So it is also effective against gram-positive, gram-negative bacteria that we know. But in severe Lyme's disease, ceftriaxone is preferred. Ceftriaxone, the main advantage is that it has a long half-life, which allows for extended activity in the body compared to other antibiotics. And even in immunocompromised patients, it provides a reliable treatment for a severe Lyme's disease in patients with weakened immune system from conditions such as cancer or HIV. In that case, doxycycline may not be helpful. So therefore, ceftriaxone IV is the one which is preferred. Ceftriaxone is available only as intravenous or intramuscular injection and not in an oral form. This is the picture of the Ixodes tick. This Ixodes tick is the same vector for the Lyme's disease, for Babesia, for Anaplasma, as well as ehrlichiosis. This is how an Ixodes tick looks. So, how do you differentiate ehrlichiosis? What is the symptoms, or how does ehrlichiosis happen? Ehrlichiosis is also transmitted by the same Ixodes tick, but here there will be a circular rash but without any target appearance. So this is the difference mainly between Lyme's disease and ehrlichiosis. In ehrlichiosis, there is an additional feature, that is, there are intracellular bacteria that forms distinctive clusters resembling berries. So this is how the intracellular bacteria will form distinctive clusters, and in the vignette they will tell you that the blood smear shows berry cluster aneurysms, or the blood smear shows intracellular morula within the phagocytes. In that way, we can understand that it is due to ehrlichiosis, even though it is by the same tick Ixodes. What about scabies? Scabies is caused by Sarcoptes scabii. So that you can see here, the enlarged picture is this. It is a mite that causes linear burrows in the skin. So here it is most commonly seen in people who are living in unhygienic conditions. So they will give you like a questions where they will tell you that a male who has been living in a homeless shelter for a few months now presents with itchy hands. So once you hear a vignette like this, you might think that itchy hands, it can be because of fungal. In addition to it, so to remove the doubt from us, the vignette will also go ahead and tell that topical antifungals were attempted but ineffective. Now you should know that it is not, the itchy hand is not because of, and they will also give you a picture of the Sarcoptes scabiei. Now you should know that the itchy hand is not because of fungus, but it is because of Sarcoptes scabies. So once you have found out, you should know what is the treatment for scabies. Topical permethrin 5% cream is the first line treatment for scabies. So, but oral ivermectin is also commonly given. So, to whom should we treat with topical ivermectin, and whom should be treated with oral topical permethrin, and whom should be treated with oral ivermectin? Oral ivermectin is for disseminated scabies infection and also for HIV patients. What about the bed bug? The bed bug causative organ. This is how a bed bug looks. The bite on the bed bug looks. The causative organism is a Cimex. So it is usually travel and stays in budget accommodation areas, like for example a very dodgy motel or something. So the vignette can give you a presentation like this, and they will tell you that they have a pruritic papules after sleeping in this motel, and or the vignette can present in that way. Then you should know that it is bed bug which is caused by Cimex. What is this? This is the Kopliks spots which are seen in measles. You should know that measles is also known as rubeola. So here they will give you a picture, like usually measles generally doesn't appear in vaccinated individuals. So they will give you a vignette like 6-year-old or a child whose family recently immigrated to US from other country, and they say that they will be presenting with diffuse maculopapular rash, and a photograph of a buccal mucosa is also present. So measles will present with the maculopapular rash as well as Kopliks spots. Now what is the diagnosis and what is the treatment? Diagnosis is measles. That's what you should know. Here there is another entity known as German measles. Measles is rubeola, whereas German measles is rubella. German measles will generally present with suboccipital or post-auricular lymphadenopathy. The illness will be generally less severe when compared to measles. But whereas measles will present with confluent both will be having a maculopapular rash, but since German measles will be somewhat mild, they will be having only fine maculopapular rash. But measles rubeola will have confluent maculopapular rash, more severe illness, Koplik spots on buccal mucosa, and there is also higher complication rate. When they ask you about the treatment, both measles as well as German measles, the treatment is supportive. What about mumps? Mumps, it presents with mainly three important features: parotitis, meningitis, orchitis. Generally, the mumps will present only with the swelling of the parotid glands. This happens only in severe cases and not in all. Not all people affected with the mumps end up in meningitis or orchitis. The mumps will per se cause parotitis and will get and the body will take over and with just a supportive treatment. But what they will ask you is that whether it is an RNA virus, whether it is enveloped, whether it is segmented or non-segmented. This is the knowledge which you need to know. It is an RNA virus, it is enveloped, but it is non-segmented. So this has been asked previously in MLE exams. What do you know by congenital cytomegalovirus? Congenital cytomegalovirus, the hallmark of congenital cytomegalovirus is intracranial calcifications. In addition to it, it will also result in blueberry muffin. Blueberry muffin can occur in cytomegalovirus as well as syphilis too. So there will be no cardiac system involvement. But whereas in rubella, there will be blueberry muffin, also rash, and in addition to it, there will be patent ductus arteriosus. That's what cardiac system will also be involved. So therefore, that is a key distinguishing feature between rubella and cytomegalovirus. Cytomegalovirus belongs to the herpes virus family. So therefore, like other herpes viruses, this will also establish latency and it can reactivate later. So this infection persists lifelong. Let's see about parvovirus B19. The disease caused by parvovirus B19 is also known as fifth disease. Here, generally, there will be initial 3 to 7 days of a fever, which is a prodromal phase. This phase is the phase where it is most infective, where they will be presenting with just a fever. After the prodromal phase, the child will present with slapped cheek appearance, which is followed by rash, but however, mostly fever followed by slapped cheek appearance and rash. So when during this slapped cheek appearance, one should know that it is the infectivity or the communicability, the virus from the child or from the person who has been affected will not get transmitted to the other person. That's what, now they are in a safe zone. It is no more contagious. You should also know that parvovirus B19 also causes aplastic anemia, isn't it? So, how will you diagnose parvovirus B19? First is IgM titers against the virus. Then after that, we can do bone marrow aspiration. This knowledge will be tested in exams, like a child who's having a fever for 2 to 3 days ago, brought in by the mother, and showing this slapped cheek appearance. What is the answer? What is the diagnosis, and what most likely causal organism can also cause? What other disease can this organism also cause? So this is parvovirus, and the presentation is slapped cheek appearance, and it can also result in aplastic anemia. This is again a parvovirus, which is, so what we saw previously is in children. Parvovirus can also result in rashes in the adults. So adult with a fever and rash, especially in a daycare setting, parvovirus B19 can also cause this. Parvovirus B19 IgM titers are the diagnostic test of choice. What do you know about eczema herpeticum? This is how an eczema herpeticum will present. But here, what does eczema herpeticum mean? Eczema herpeticum is the herpes virus, which is the HSV1 or 2 infection, is being superimposed on eczematous skin. So the patient is already having eczema, and somewhere else they are having herpes virus. So due to self-inoculation from the herpes virus in the eczema, that is known as the eczema herpeticum. It will result in a painful burning rash with fever as well as lymphadenopathy. Because fever and lymphadenopathy and painful burning rash are typical of herpes virus. What are the risk factors? Atopic dermatitis, contact sports, like all those are risk factors. This is usually treated with oral acyclovir or valcyclovir targeting the herpes virus. So here the question will ask you, like, 17-year-old male who's a high school wrestler has history of atopy plus has burning painful rash on the trunk, lymphadenopathy and fever. So image is shown. Answer is, what is the next treatment? So the treatment is acyclovir or valcyclovir, and the diagnosis is eczema herpeticum, human herpes virus 1 or 2 infection superimposed on eczema. This is often self-inoculated from touching cold sore, then crackle the skin of the eczema. So this is how it is present. What do you understand by herpes zoster in zoster? Herpes zoster is also known as shingles. There is no virus by name herpes zoster. This is the first one that we should remember. So, what is the virus that causes shingles or herpes zoster? Very good. Varicella zoster virus, which is also known as human herpes virus 3, is the one which is responsible for causing varicella zoster or chickenpox. Here, the chickenpox or varicella zoster will cause unilateral vesicular rash, which is restricted to a single dermatome. Mostly for the varicella zoster to get reactivated and cause herpes zoster or shingles, there has to be any reason. Say for example, immunocompromised status, chemotherapy with the ALL, there has to be some reason where it causes a shingles or this. Okay. So here, so just an overview of all the viruses. Human herpes HHV1 and HHV2 are the human herpes virus family causing human herpes. The virus is herpes simplex virus 1, herpes simplex virus 2. HHV3, human herpes virus 3, is the one which is responsible for causing chickenpox or the shingles. Reactivation can result in shingles, that is the varicella zoster virus. Human herpes virus 4 is Epstein-Barr virus, which can cause infectious mononucleosis. Human herpes virus 5 is the cytomegalovirus, which can cause cytomegalovirus mononucleosis. Human herpes virus 6 is the virus which causes roseola or pityriasis roseae. Human herpes, no, roseola and pityriasis roseae. While human herpes virus 7 also can cause, so this is still not very clear which one causes which, but it is postulated that human herpes virus 6 and 7 causes roseola and pityriasis roseae. Human herpes virus 8 causes Kaposis associated herpes virus, where it is resulting in Kaposis sarcoma. So we are finishing it with herpes zoster oticus, where I already told you that herpes zoster is that which is caused by reactivation of varicella zoster. So when herpes zoster oticus is reactivation of varicella zoster near the ear or the branch that is supplying the ear, that is the facial nerve. So varicella zoster virus reactivation in the facial nerve, which has been characterized by facial palsy plus vesicular eruption in the ear canal or in the auricle. So this is how the varicella zoster oticus. Sometimes it will also be scarred and black scars can also be seen. So when it affects the facial nerve, acute onset facial paralysis, that is Bell's palsy with vesicular lesions around the ear is seen. So it can appear non-vesicular or black. That is what you know. So because of the reactivation of varicella zoster virus, we should the shingles vaccine is indicated for adults aged 50 and older. So this can also be tested in MLE. So now so this can also cause Bell's palsy. Lyme's disease can also cause Bell's palsy.